Hi, this is Dr. Darwin Hayes, your new dentist coach, with the next edition of Ask Dr. Darwin. And today's show, we have a future student dentist that has some exciting news that he's going to share with us, but he also is going to ask a question about his pursuit of dentistry, but more specifically about a specific part of dentistry that he's interested in. So today we have future student Dr. Anthonio McFadden. How you doing, man?
I'm doing very well, man. It's been an honor. It's an honor to finally talk to you. I've been following your videos for a while, so I'm in a good space right now. I finally got accepted at the dental school, so
tell us a little bit about
the next step and trying to get some guidance from you.
Yeah, that's great, man. Congratulations. I know it's been a long process for you, but you persevered and got it done, so that's great. Now, where are you going to be going to school?
The University of Detroit Mercy School of Dentistry in Midtown Detroit.
Detroit, D-Rock. That's awesome, man.
So,
congratulations. Yeah. Are you from?
Thank you. Yes, I am. I feel like I got scouted to the home team, So it's a very good feeling.
That's great, man. That's great. So you applied to dental school, you got in, and you'll be starting in July, late July, August, right? Or late August.
August 13th is orientation. August 19th is white coat ceremony. August 20th, first day of classes.
There you go. So you already know. So you got into dental school. Now what? Right? That's probably one of the big questions for a lot of people. You get into dental school. Now what? But you also have some other questions. So let's dive into those.
Okay. One of my questions is specifically, I guess, this is a better segue than the question about residency. I've been talking to a lot of dentists. I also am a dental assistant, have been a dental assistant for about 3 years now. So I put myself around a lot of dentists, a lot of older dentists, a lot of new dentists. And a lot of older dentists are talking about this student debt, as I am myself thinking about the student loan debt that I can accrue throughout the time of dental school. When I'm talking to general dentists, I see they're getting out specifically with private schools like Detroit Mercy, they're getting out of school with over $350,000 in debt. Do you think that it's worth it to go into general dentistry knowing that the wages are a little bit lower than someone who specializes, to pay back that student loan debt at the same time that they're first getting out of dental school and making such a low wage, as compared to how much the student loan debt is?
Right. So I guess for me, I have a little bit of a different perspective because, when I came out of dental school 20 years ago, it was a lot different as far as the debt. But also there's different avenues to practice your craft, whether it be as a GP, as a sole practitioner, working in a group practice, working as a partner in a DSO, being the owner of the practice and collaborating with the DSO. DSO stands for Dental Service Organization. Those organizations usually give some type of management support to you as an owner dentist, versus doing something like a specialty program where your wages and your income is going to be a little bit higher. So I think either way, people get it done, man. They get it done. There are a lot of things outside of just your salary that new dentists are looking into that help to lower the debt ratio, or even have some of the debt be wiped out. There's many loan repayment programs throughout many states. There's also locations, offices where you can work at a FQHC, Federally Qualified Health Center, and they have some loan repayment programs. Lots of times, if those centers, if they have a certain score, a certain rating, the government will have programs that allow you as a practitioner working at that institution or at that center to have some opportunities to reduce your debt, if not even wipe some of it out. There's also HRSA, Health Resource Service Administration, where they have different grants for dentists or institutions where they have programs where there's like a loan repayment program. So, you know, I think a lot of the information that you've been getting from new dentists or even the older dentists that have been practicing, you know, more than 20 years, for us to hear the amount of debt that you guys have is like, wow. You know, I mean, I've got residents at NYU that are coming out with 450, you know, 450 of debt, but they get it done, or they're working through being able to handle it. So I guess it's all relative. The cost of dental education 20 years ago versus what it is now, and paying back loans over a period of time. I mean, you got to think of it like this: it's an investment. All right, it's an investment. The $275 that you're going to be putting into the University of Detroit Mercy, probably within 2 or 3 years, you'll make that, right? You'll make that as far as part of that investment, and that's just in the first 2 or 3 years, first 2 years. But your career is going to be much more longer, right? It's going to be it's going to span another period of 20 or not 30 or 40 years. So you have to look at it as an investment. And, you know, you'll get connected with some people that'll tell you, yes, you have debt, but you don't want to pay off all your debt immediately. You want to put money also into areas that are going to allow you to make money for you, right? Lots of times, some of this debt is very, very low as far as the interest rates. And there's some financial planners out there that can assist you with taking your income, yes, putting some of it towards your debt, right? Because that's something that's never going to go away, as far as you can't just write it off completely. And then they'll also tell you put a portion of your income towards things that are going to protect you as a practitioner, so that you can be able to pay back your debt, but also have some money set aside that's going to be making some money for you at maybe a much higher interest rate than what you're paying for your loans. Maybe your loans might be a 3 or 4 or 5%. Putting income that you're going to be earning into vehicles that are going to be yielding a much higher percentage rate on a return on your interest. So there's many different ways that people are handling their debt, one of which is increasing their income and being able to have a budget that allows them to do many different things across the continuum. But again, just like dental school and this whole process of lifelong learning, managing your debt can be a marathon, meaning it's not something that you just want to do a quick sprint and you want to be done with it in 5 years, because all that money that you're putting towards, and this is just my opinion, all the money that you're putting towards your debt in the first 5 years of trying to pay it off, there's other things that you could be investing in that's going to have a much larger return in excess of your $275 of your investment for dental school. So I guess my biggest advice is, you know, let's get you to a point where you can seek out those people that can help you more with managing your debt. I know ASDA, the American Student Dental Association, they have weekly blogs, and one of the topics they have on there right now is managing school debt. What are some of your options? There's some refinance options, but there's also options related to options as far as FQCs and loan repayment programs, all of which will allow you to do two things. It'll allow you to pay off your debt or have a portion of your debt be paid off, but also have some training, get some additional training and some advanced training that are going to help you. That's going to help you after your debt's paid off also. So there's a win-win in some of those options. But yeah, I definitely understand your concern as relates to paying off your debt. And for some people, you know, that's one of the reasons why they choose a specialty or they want to specialize. Not only do they want to just kind of focus on one aspect of dentistry, but it allows them to have command a higher income than those of us that are just strictly GPs, you know, oral surgeons, endodontists, pediatric dentists, all of which typically have a much higher starting wage or salary in the profession. But there's also additional training that's associated with it. You know, you finish dental school, and if you're going to become an oral surgeon, for example, that's another 4 to 6 years. And depending on what program, it may be a paid program where you get a stipend, or it may be a program where you have to pay. So that can add to your debt and your investment in yourself also. So, you know, everyone is different. Yeah, go ahead.
Yeah, that's the thing that I mean, I'm not only interested in the aspect of the beneficial, I mean the monetary benefit from, you know, going into a specialty, but it's a huge reason why. But I'm also interested in the medical aspect of oral surgery as well, which is the reason why I'm really interested in going into the profession. Do you feel like that is something that would be beneficial to a student to look into right now? How do you feel like a person should enter dental school if they feel like, if they want to pursue oral surgery?
Yeah, that's a great question, and I got a great answer for you. I actually have 2 mentees like yourself that just got into dental school. They just finished their first semester, and they already know. They knew, like yourself, they knew, hey, I want to be a specialist. I want to be an oral surgeon, or I want to be a pediatric dentist. So one of the things advice-wise that I gave him, which again is planning and doing stuff now so that it can get you to your trajectory of becoming an oral surgeon or pediatric dentist, things that you're going to be doing and focusing on right now. You get into school and on August 19th or the 21st, is you got to keep in mind the first year, those classes that you take, especially in anatomy, physiology, chemistry, biochem, biochem, those science classes, a lot of those classes have a very, very heavy weight, right? Some of them 8 to 12 or 15 hours of weight. As far as, you know, when you get a grade, if you get an A in that class, that pretty much sets your GPA for the whole year. These classes, your first year, are gonna set the foundation and be a major component of your GPA, which is gonna steer you in the direction of your acceptance into oral surgery. Okay? So my advice to you is, since you kind of know I'm gonna be a specialist, I'm really focusing more on oral surgery right now, your target for the first year is all A's and B's in all your classes, all your science classes, because those classes have so much weight that's gonna carry you through your second, your third, and your fourth year. The first year is the foundation, especially if you're gonna specialize. It's going to be the foundation for your GPA. And at Detroit Mercy, I think I don't think it's pass fail. So that's good for you, especially for you coming from there and applying to specialty programs, because it allows the programs to see the more traditional numbers that they're looking for selection. So because Detroit Mercy has a GPA and they offer GPA, and they're probably going to offer, they'll also have a class rank, you want to be up here, starting right from the gate. You want to be here. Well, put it this way, everybody starts with an A. When you start in August, everybody starts with an A. It's just a matter of whether or not you're going to maintain that A for the first 2 semesters. You want to be maintaining that A, because that's going to have a lot of weight. So that's one thing that you.
So I heard you. I'm sorry. Go ahead.
No, you're good. You're good.
I I heard you talking to one of the other student doctors who was, I think he was a third year, and he's going into oral surgery. And I heard you talking to him about the test that they take, similar to the step 1 exam. How I kind of broke it down and looked at it was you have any time throughout your 4 years to take that exam. What would make it different for me taking it that first year rather than that second year? I know in the second year, or the summer after my D2 year, I'll be taking some more science courses. To the same extent, I feel like all the knowledge is available online. So if I was able to put myself in a mode where I can take that test after D1 summer, do you think that'd be better for me, specifically because I still have to take my board in that D2? Or would you rather have a student who's pursuing oral surgery wait until after D2 summer to take that exam?
One of the things that you have to do is you have to look at that exam that dental students take when they're applying into oral surgery. You really have to go back. What I would tell you is go back and look at the content of the exam. Because quite honestly, for oral surgery, even though they look at your GPA and they're going to look at your national boards, part 1 and part 2, what they're really looking for is how you did on that exam, that medical exam. I can't remember the name right now. The acronym of the exam, but that is the exam that programs look at. And I think for right now, if I'm not mistaken, you need to have like a 60 or higher on that exam to really be competitive, or to maintain yourself and be competitive for oral surgery. Whether or not to take it your first year or your second year is really depend on what you find in the breakdown of that exam, and as it relates to what you're going to be learning first year, first and second semester, and then also second year, first and second semester. I will tell you, depending on the school you go to, and I'm not sure if this is the case with Detroit Mercy, you may start clinic as early as first or second year, meaning some schools now are pairing the first years with the second years, with the third years, and the fourth years, and they're all part of a team. And you may have, as a first year D1, you may have some clinical requirements or a rotation where you're part of a team with the other D2s or D3 and another D4, just as a transition. So that's going to take some time away from your studying. It's going to take some time away from other things that you could be doing. If that's not the case at Detroit Mercy, then you have that time to possibly continue to get prepared for the medicine exam. Typically, I would tell you, I think most people take it after the second year, but it does not mean that you couldn't take it after the first year. But I think what's going to happen is that you're going to be tired, man. This first year, when you start in August, it's going to be intense. And finding time to study for that exam during or after you've had a real intensive first year, you may or may not be up to it as much. You may need a time to just exhale and kind of relax before you tackle studying for that exam. So as part of your homework, I think I would first advise you to really look at that exam, break it down and see what the content of it is, and then how it relates back to things that you're going to be learning your D1 year, and see if it's a 3-to-3 mesh, meaning there's 3 classes, and there's three subject areas that are kind of the same. I may be able to, understand and know how to prepare for it because I've had these 3 classes and these are the 3 sections and they go together. Or you may find that you may have to wait until you start your second year where you have some more science and some more information that's applicable to really being prepared for that medicine exam. And then also keep in mind, you're going to have part 1 of boards, national dental boards, which is a lot of your sciences that you're having your first and second year. So you're going to have that exam. You gotta take that. That's part of your requirement for graduation. So that'll also be coming up after your second year. So, you know, you'll have a lot of stuff to prepare for after these first 2 years.
How do you, now knowing that you know a lot of students and network with a lot of students, what are they saying about what they should have done starting out in dental school when they first went, or some things that they would have done or tell new students about when they start dental school, just to be better, or to, you know, to heighten their grades, or I don't know, to be mentally better or physically better?
Well, one of the things that I hear, there's a couple of things that I hear. One of the things that I hear is residents that have just graduated that were thinking about a specialty. They wish they had, now that they do want to pursue the specialty, say oral surgery, they wish they had started earlier in preparing for building a great foundation GPA wise. All right, because oral surgery, I mean, they typically take the top people in the class. Ortho, same thing. Pedo and endo, pretty much the same thing. So that ranking starts early, man. That GPA starts early. It's that first year. It's that first year. Anytime you have a class that's 10 credit hours out of 25 or 22, or even a little bit more than that, that class is going to dictate what your GPA is going to look like. So many of them have said, I wish I was more focused my first year, and I was, you know, more adamant about being in pursuit of a high GPA and maintaining, getting an A for the class. That's the first thing. The second thing is, I think I've heard from many students, or former students that are residents now, that as pertains to your pursuit in oral surgery, they wish they had studied more for the medicine exam. During the time that you're going to be in dental school, as soon as you hit clinic, your D3 year, you're going to be busy, man, with patients, managing patients, getting requirements done. You're going to have to find time to really carve out to study for that medicine exam for oral surgery. Many of my residents have said, I wish I had more time. I wish I had more time. Even when they are residents and they finish dental school and they're applying to oral surgery that same year, some of them are just taking the exam for the first time. So what they have found is that they wish there was a guide, because right now there is no guide for that exam. There's no, like for the DAT, there's a couple of different study programs. Crack the DAT booster, and etc. For that exam for medicine, there is no study exams. There's no like Kaplan course on it. So what many residents have found is that they have to go back to their old dental materials, right? Go back to their old dental decks from part 1 of national boards, part 2 of national boards. And also they're doing some other research of gathering information so that they can learn and be better prepared for the exam. That takes time, right? As a resident, you know, you're going to have, as a GPR resident or as an AAGD resident, you know, depending on where you go, you're going to be on call. You're going to have patients. You're going to be seeing 4 or 5 times as more patients as a resident than you are as a dental student. So that means you got to be more prepared for those patients. You have to write up all those charts. You're going to be seeing 2 or 3 patients a day as a dental student. As a resident, it's 8 to 12. So that's more patients you have to be prepared for, which means more time, which also means possibly less time for you to study. So one of the things that many of the residents have said is, I wish I had carved out more time to study specifically for that exam. So I think you kind of get the idea now. And I will tell you, for oral yeah, I was gonna say for oral surgery, I mean, it's recommended that you do a residency after dental school. It's not too many people that are coming. I mean, it happens, but there's not too many people coming directly from dental school right into oral surgery. I mean, it happens. It's a small percentage, but I think you're a much well-rounded candidate, especially if your GPA is not, if you're not number one, or I mean, if your rank is not number one, or 2 or 3 or 4 or 5 in your class, and your GPA is not, you know, a 3.7 and higher. Doing a residency is going to enhance your candidacy, because now you're going to be managing patients, you're going to have more confidence, and depending on the program that you do, if you do a GPR, you may have an oral surgery rotation where you're going to be exposed more to the area that you want to specialize in, which you can add those types of credentials and the procedures that you're going to be doing to your application for oral surgery.
So specifically for oral surgery, would you rather say a person should go into a residency for a GPR as compared to an AGD? Because in my understanding, the AGD is more towards general dentistry, going to practice in private practice, where a GPR could kind of put you in that hospital setting where you're probably doing more extractions and seeing more cancer cases or things that pertain to oral surgery residency.
Right, absolutely. So you hit it right on the head, man. I would, especially for oral surgery, and for you, since you have an interest on the medical aspect, a GPR is going to be your route. But you have to keep in mind, and this is something we'll talk about over the next 4 years, but just in general, not all GPR programs are the same, meaning some have more of a comprehensive care. Yeah.
Didn't know that.
Yeah, no, just because the program says GPR doesn't mean that all of them are the same, in the sense that one may have more of a focus just on extractions and emergency care. Another one may have more of a comprehensive care but you still have a rotation in oral surgery, but it's oral surgery as relates to all the other disciplines and more of a comprehensive care type of approach. So, so you would have to choose your residency based on that, but also you want to be looking at residencies based on people that are going to those residencies and what they're doing afterwards. Are they going into specialty programs? Are they going into oral surgery? How many people applied? How many people got in? And some programs will have some of that data for you as you get to that point. But you're right, GPR would probably be the best way I would recommend for someone who's interested in oral surgery, so that you get the hospital side, you get the medical aspect, but you also get, and you'll be on call, right? You're going to be on call, after hours call, from 5 to 7 in the morning, so you'll have a chance to interface. And some programs, especially AEGD programs, since those residents don't take call, the people that take call for those patients that are at the AEGD programs are the GPR residents and the oral surgery residents. So you want to be in a program where you're going to be taking call, because as an oral surgery resident, that's what you're going to be doing. You're going to be handling all of the traumas that come into the ER, or the ED, the emergency room, the emergency department, as relates to shoulder up. That's our area. Dentistry, that's our area, but more specifically, those fractures, those lacerations, those facial swellings that get into the submandibular spaces, and I mean, all of that, that's our area, but more specifically, that's oral surgery. So you want to be in that environment, and that environment is GPR program.
Okay, so in a sense, with those first 2 years, kind of take advantage of gross anatomy, human physiology, biochemistry, because it relates also to the exam that you're taking, that medical exam, but also it's keeping your GPA as high as possible.
Yes, absolutely.
Okay.
Absolutely, man. Absolutely.
Okay. Another question would be also it's kind of Another question would be, how do you feel about the new, I guess, era of general dentists? Do you feel like as a general dentist who wants to be a really successful general dentist, do you feel like they should be going into dental school trying to be the best at all of the specialties, or do you feel like a lot of the general dentists now should focus on specific ones to kind of tackle that if they specifically want to go into private practice rather than going into a FQHC or corporate dentistry? Because I watched what's the guy's name? Dr. Robert, is it Dr. Howard Ferran on Dental Time?
Yes.
So a lot they speak about the general dentist, the Catholic, and what that is basically the person who's either good at all 10 specialties or the person who's really good at one specialty as a general dentist, and they kind of focus on that. Do you like
I think I lost
going into general dentistry?
Just repeat the last 5 seconds. I broke up. We had a bad connection. You said Howard Ferran. You saw him talking about
the Catholic, and basically the top years of being good at all 10 specialties of general dentist, or you're specifically good at one or two specialties at general. I mean, you know how to do all of them, but I mean, you kind of focus on one or two in private practice. Do you feel like a general dentist should be good at all 10, or you feel like a general dentist should kind of focus on one or two to kind of make your private practice as best as possible?
Well, here's the thing, man. It really depends on the individual. And you won't really know this until you get in clinic and you start doing procedures, and you may not even realize it until you do a residency. Right now, you don't even know what you like and what you don't like because you haven't done anything, right? So for many of us as general dentists, we all kind of start off as general dentists because everybody's doing in dental school. You're doing just about all aspects of dentistry. I mean, you may not be doing any ortho, but you may have some observations. You may not be doing a lot of pedo, but you may have some observation. But the challenge is when you do those procedures as a general dentist, when you do oral surgery, especially some of the complicated or maybe not so routine third molar extractions, when you do retreatments in endo or second molar endo, when you do some full mouth rehab cases as a prosthodontist, or you're doing it as if you were a GP, but you're doing it in that area. As a general dentist, you are held to the same exact standard and quality that a specialist would do it. As a general dentist, my opinion is this: there's no way that you're going to be able to be proficient at the same level as a specialist, as the endodontist, as the oral surgeon, as the prosthodontist, etc. Because as a general dentist, we haven't had that specialized training. The endodontists have some classmates. I mean, their training is so specific and detailed for 2 or 3 years that it doesn't make a difference how many root canals we do as a general dentist. We're not going to be as proficient and have the same type of training as those endodontists unless we go through that specialty program. And that's just my opinion. But one of the advantages of being a general dentist is that if you do have interest in several of those areas and you like kind of doing a little bit of everything, you just have to keep in mind that you have to do it at the level of the specialist. And you have to have enough discernment to know, all right, I'm not messing with these third molars. I'm going to refer that out. Or you'll have maybe an oral surgeon come into your practice 1 day a week. Or maybe you have an orthodontist come to your practice 1 day a week. Or you have an endodontist that comes in 1 day a week. Or you refer to a buddy of yours that's down the street. You, as a GP, we're kind of like thought as the gatekeeper in the sense that, and it's the same thing in medicine too. We're the gatekeeper in the sense that everyone comes to us. We're kind of like the primary care provider in medicine. They come to us first, and then we refer based off of our level of comfort and our own level of expertise. So I think for many of us as GPs, you have to, it's a personal thing of really feeling comfortable, feeling comfortable with what you're not comfortable with, and being able to refer that out to the patient, and also kind of spread out the liability, right? Because like I said, if you're doing second molar endo, and some of these have curved canals and or secondary canals, and this is like maybe your fourth one that you've done, an endodontist has probably done 4 or 5 times as many. So his or her level of expertise is this way, where yours is kind of like this way. But at the end of the day, we are held to that same higher level, but we don't have that training. So you also have to know what your own limitations are, in a sense, and being able to pass out that liability, but still service the patient, because the patient's still going to come back to you, going to come back to us anyway, right? They have to come back to get the build up in the crown and for maintenance and everything else. So, so it's okay to be a super GP or decathlon type of GP that Howard Ferran mentions of Dental Town that he mentions, but also you have to know what your own limitations are to pass out and distribute that liability, so that you're still being able to be effective as a general practitioner. I think what the trend is today is that everyone wants to do a little bit of everything. But it's like, if you're doing 10 things at one time, there's no way you can give 100% to each of them. If you're doing 10 things at one time, that means you're probably only going to be able to give 10%. So some of us, so some of us as GPs find, maybe 2 or 3 areas that we really, really like. I like taking out teeth, but I also know what my limitations are. And I know if it's going to take me much longer, you have to weigh that time period. It's going to take me 30 minutes versus 10 minutes. That extra 20 minutes adds up over the course of a day. I could be spending that 20 minutes doing something that I'm more proficient at, which is cutting a crown prep or doing a whitening or doing some veneers. You see what I'm saying? So you have to kind of think of it also as time, not just income and inflow, but also your time, because your time is just as valuable. So a lot of these DSOs that are out here, they're keeping everything in-house, but guess what they're doing? They have a GP, but they also have specialists that are in-house. So you don't have to send it out to another office. The DSOs have leveraged all the specialties and everybody's under one house. And which is a great patient relations things, because now the patients don't necessarily have to go out and meet a new dentist or a new person and have to go through the rigmarole of having to go here and there. Everything's under one house. So, and that's also good for the practice. Like I said, patient relation wise. I worked in a couple of DSOs where we had an orthodontist was there 2 days a week and every other Saturday. So we didn't refer any ortho cases out. Any cases that I had that I wanted a consult, we had them scheduled with the orthodontist right there in the office. There was an oral surgeon that came in once a week that was doing IV sedations and implants. At the time, I didn't have a lot of implant training. Instead of me sending it out or not being able to provide that service to the patient, we had an oral surgeon, or we had a periodontist that placed implants, that did surgical and IV sedation surgical procedures. We kept it in-house. So everything was under one roof, so to speak. And so there are many GPs that have that kind of concept, where even though they may not feel proficient, they still have those other activities or those other events, other decathlon events within their office.
I understand. You hear me?
Can you repeat that?
Yeah.
lost you for a second.
My last question is, how do you feel about the future of corporate dentistry? Do you feel like it's going to be harder for the new doctor to go into private practice and eventually own their own practice? Or do you feel like that corporate dentistry is becoming such a colossal that they're taking a lot of the new students and they're going to be working at corporate dentistry offices for the rest of their lives to try to combat this student loan debt?
Well, I don't think they're going to be at corporate dentistry for the rest of their lives. I don't think that, but I mean, time will tell. But I think the challenge for many solo practitioners is based on the consumerism. It's really based on consumerism. Consumers or patients have these dental plans. Unfortunately, they have not changed in the maximum amounts in over 30 years, maybe even 40 years. I mean, back in the late 70s, you had a maximum of $1,500, and here we are 40 years later, and it's the same $1,500. So a lot of solo practitioners, I think, if they're not able to really leverage the things like the lab, one of the things that a lot of the DSOs have been able to do, because they have so many offices spread out throughout the country, 200, 300, 400 different offices, they're able to negotiate fees, lab fees, with a lot of labs, whereas you and I as solo practitioners, for a crown, it may be $200, but for these DSOs, they can get them for $75. That's very hard to compete with long-term because it's an expense. And I think one of the challenges that many private practitioners have is being able to really pull together their resources and be able to compete and trying to find ways to lower their expenses, but also increase their revenues. And then, like I said, the whole notion of consumerism, you've got patients that they just want to go to whoever takes their insurance. They don't know that you were number one in their class and I was number 150 out of 151. They don't know. They don't care about that. They want to know, do you take my insurance? When can I get my free cleaning? Did he hurt? Were they nice to me? That's pretty much all they care about. So that also is a challenge for everybody, even for the DSOs. It can be a challenge. But one of the things that the DSOs they operate more on volume, and they'll take a lot more insurances because they're set up to do such, right? Their business model is set up to do such. Some solo practitioners are not set up to do such because their cost of operating their offices is much higher than what they would be getting in fees or revenues if they accepted all these insurances. So that's the challenge. That's one of the challenges that a lot of private practitioners have versus those that are going into DSOs. And the reason why a lot of graduates are going into DSOs is because of, like you said, you mentioned the debt, but also there are not a lot of options. There's the options of kind of starting from scratch as they were 20 or 30 years ago are not as many as it's not as many now as it was before. Your higher debt typically can be a distraction for banks wanting banks that you're going to be looking to actually ask for a line of credit or a loan to start up a practice. I mean, you're looking at $300,000, $400,000, $500,000 to start up a practice on top of $300,000 or $400,000, $500 of student loans. And you haven't even proven that you're able to produce, $500,000 worth of dentistry. So it can be a loan risk for a lot of these banks. So what's the option? Well, the option is you go to a practice or entity that's already established. You work as an associate. You make $150,000, $170,000, $180,000. Eventually, or at some point, there may be an opportunity to become a partner. the way the DSOs operate, the owners are the doctors, not the dental service organization. You have to have a license to own a dental office. So the dentists own the office, and that's where they are able to collaborate with the DSOs, because the dentist must own the office. And a lot of those new dentists, they'll if it's successful for them and they like that environment, they stay on, they become an owner, they buy that practice or they own that practice, and then they end up going to get practice number 2, number 3, number 4. And that's typical for a lot of the DSOs like Heartland, for Aspen, et cetera, where new graduates are coming in after a residency, and that's how they kind of get into ownership that way. So it has changed over the last 20 or 30 years, and it's going to continue. These DSOs, they are continuing to expand and open new offices and acquire new offices, acquire the small office down the street that the doctor just, she can't handle not having a lot of patients anymore. She partners up with this DSO. They give her the support. She might have some change in insurances, but now she's viable. She's able to stay open, and she's able to make a living. So that part is not going anywhere. That aspect is not going anywhere in dentistry. So some really good questions, man. I'm really excited for you as it relates to you getting in this career and starting to have questions early about things that are going to be happening 4 and 5 years from now. That's great, man. That's how you gotta be. And I'm proud to hear that that's where you're headed, in that direction. So I hope this informational session has been helpful, man.
It has been very helpful, man. You're like you're just got all this knowledge, man, that I need. You know what I mean? So it feels good to talk to someone who's very knowledgeable about what's going on in the student lives today, because a lot of general dentists now who graduated 20 years ago are not really in tune with what's going on in the new students that's going into dental school, as well as you're knowledgeable about the things that, of general dentistry in a whole. So I feel like it's very important to talk to you.
That's right, man. And keep in mind, one of the things I want us to do while you're going through this process, because like I said, it's a marathon, right? I definitely want to get you in contact with some students that are just like you, in the sense that they're just started their first year. They're in it. They're, doing well. You need to talk to them, kind of get a perspective, because it's good to get perspectives from different people from different parts of the country to see what their experiences are, because that's going to help you too. All right. They don't necessarily all have to go to Detroit Mercy. They could be at Michigan. They could be at Howard. They could be at Maryland. They could be at University of Florida. And it's good to be connected with those people too. One of the things I would encourage you to do is, throughout your career of training, for your dental school training, get involved with portions of organized dentistry, not only for the information, but also for the social aspect, because then you'll start to learn from others. Part of this process is going to be, you're going to be learning from other people, not only just from school and from the books, but you're going to be learning from other people, other students, not only at your school, but at schools throughout the country. And you want to have that perspective, because there could be someone that you meet that has already gone through the process of oral surgery. And, one of the things I encourage you to, we're going to get you connected with some current students that are applying to oral surgery, so they can tell you more of a real time what's happening, what's part of the application process, what they would do differently, knowing what they know now as a D3 or D4 student. What would they do differently if they were to start this whole process again as a D1 student? Those are the people you need to talk to, because they're doing it, and you're right behind them. So we'll get you connected with some of those folks. I have a couple of former residents, GPR residents that are in oral surgery programs now. Have a couple classmates that are oral surgeons, all of which you need to be connected to. And keep in mind, during this process, not only are you going to be learning, maintaining that GPA, keeping that A that you already have, that you're going to start with, but part of this process is that you got to expand. That expansion means you got to go and meet people and find the people that are doing the things that you want to do, right? That are there, that have already accomplished it, or in the process of accomplishing it. At some point during your 4 years of dental school, I would tell you, you're going to need to go to the oral surgery meeting, the national meeting that they have every year. American Academy of Maxillofacial Surgery, I think it is. They have it every year. You need to be going just to go and be around that group of people, be around the environment, be around the specialty profession that you aspire to train under and to become a board certified oral surgeon. You got to be in that environment to see what it looks like, feel, touch it, and everything else, so that you have more reality as to how to tackle your goal and your target. So throughout this process, man, we'll get you connected with those people, and just stay hungry, but also stay dedicated to the end goal, which is to become an oral surgeon, if that's your choice. Okay?
Yes, sir. I appreciate you.
Hey, man, I appreciate you. I'm glad we were able to connect. And if you guys out there have questions like he did today, feel free to contact me at NewDentistCoach@gmail.com, NewDentistCoach@gmail.com. Hey, for being on today's episode, I got something for you. I don't have it with me right now in front of us, but I'm going to send you a shirt. It's a nice little shirt that says Class of 2022. So if you would inbox me, man, if you send me your address, we'll connect, and I'll get that shirt, and that'll be your Superman shirt. That'll be something that'll help you to be encouraged each and every day when you start in October, start in August, because that's gonna be that's your first end goal, right? Class of 2022.
Yes, sir.
Yeah, man. So hey, thanks so much for being on the show today, and I appreciate you, and good luck, and we'll stay connected throughout this next semester, and also over the summer. There's a couple of conventions I think you should go to that you'll start to network. Also, start networking with some of the students at Detroit Mercy if you haven't already. That's one of the things that you can do to prepare yourself for August when it comes up. This summer, be sure to relax, go on a vacation, have a good time. Because when you start in August, man, it's elbows and toes. You gotta get it. You gotta hit it hard, man. Okay, so good.
Yes, sir. Yes, sir. I'm gonna hit the ground running.
That's right, running fast too, forward and backwards. All right, so that's my time. Thanks so much, you guys, for being on today's episode. We'll see you next time on Ask Dr. Darwin, where you ask the questions and we answer them. Take care. Thanks.